In this podcast episode, Dr. Elisa Song, a pediatrician and functional medicine doctor, discusses the rise in chronic health concerns among children and the crucial role of the gut microbiome in shaping children's health. She highlights the increasing prevalence of conditions such as eczema, asthma, ADHD, and autoimmunity among kids, as well as the rise in mental health issues like anxiety and suicidal ideation. Dr. Song emphasizes the importance of the gut microbiome in the first 2.5 to 3 years of life in shaping the immune system and brain development. Factors such as antibiotic use, particularly in the first 6 months of life, and the consumption of ultra-processed foods are identified as disruptors of the gut microbiome and contributors to various health issues in children. Antibiotics, in particular, are highlighted as a major disruptor of the gut microbiome, with overuse and inappropriate prescribing leading to an increased risk of allergic diseases, asthma, and mental health concerns in children. Dr. Song warns against the indiscriminate use of antibiotics and urges parents to be mindful of their children's gut health. The consumption of ultra-processed foods is another significant factor affecting children's gut health. Dr. Song points out that these foods contain additives like emulsifiers, which can disrupt the gut microbiome and increase intestinal permeability, leading to leaky gut syndrome. She advises parents to read labels and avoid foods with harmful additives to support their children's gut health. In addition to antibiotics and ultra-processed foods, chronic unmanageable psychological stress is identified as a significant disruptor of children's gut health. Dr. Song emphasizes the detrimental effects of stress on the microbiome and brain development, highlighting the need to address stress as a crucial factor in children's overall health. When it comes to nourishing the gut microbiome, Dr. Song emphasizes the importance of limiting added sugars in children's diets. Excessive sugar consumption, particularly from sugar-sweetened beverages, can lead to inflammation, poor glycemic control, and an increased risk of chronic diseases like type 2 diabetes. She advises parents to be mindful of the sugar content in their children's diet and make healthier food choices to support gut health. Dr. Song's approach to discussing vaccines for children was met with some resistance, with her social media posts being flagged for potential misinformation. Despite this, she continued to advocate for informed decision-making and open dialogue. She highlighted the lack of research on COVID-19 vaccines for children and pointed out that kids are not a vulnerable population for the virus. By presenting the science and encouraging parents to ask questions, she helped many people reconsider their views on vaccination. The conversation also touches on the issue of birth control pills and the potential side effects and impacts on women's health. Dr. Song acknowledges the importance of birth control in providing women with reproductive choices, but emphasizes the need for informed decision-making. She encourages women to consider the effects of the pill on their microbiome, mental health, and overall well-being. Dr. Song discusses the issue of antibiotic resistance in the food industry, particularly in poultry and meat production. She highlights the importance of choosing organic and sustainably raised foods to avoid exposure to antibiotics and other harmful substances. She emphasizes the need for transparency in food labeling and regulation to ensure the safety of consumer products, especially for infants and children. The impact of screen time addiction on children's health is also discussed, with Dr. Song emphasizing the addictive nature of screens and the importance of setting boundaries around screen time. She encourages parents to provide alternative activities for children and involve them in discussions about their health choices to educate them on making informed decisions. Dr. Song shares her experience of teaching children about their microbiome and healthy choices, highlighting the impact of empowering children with knowledge about their gut health. She stresses the importance of resilience activities to counter psychological stressors and explains how a disrupted gut microbiome can contribute to various health issues in children. She encourages parents to lead by example and instill healthy habits in their children from a young age to set the foundation for a lifetime of well-being.